Everyone, I would like to thank Dr. Alok Kanungo, Dr. A.K. Das, Dr. Jayant Panda, and the organizing committee of the National Update on Clinical Diabetes for inviting me to deliver this talk. My talk is on reversal and remission and re-reversal of diabetes. So let me first put this into context and try to explain what we are talking about. So it's useful to keep this picture of the natural history of diabetes in our mind, because from the stage of normal glucose tolerance, we move to the stage of pre-diabetes, then to the stage of diabetes, and finally to stage of complications. That's how the natural history of diabetes normally goes from left to right. It was believed until recently that once you are on that process, you keep progressing and there is no regression. However, today we have evidence that you can also go from right to left in certain situations, and we'll talk about that. So once you develop clinical diabetes, you can reverse to pre-diabetes and then you can also become normal. But note that this blue arrow is not there in the stage of complications. So once you develop complications of diabetes like retinopathy, nephropathy, etc., then there is no reversal. Now, this term reversal is not preferred in scientific circles. The American Diabetes Association in October 2021 said that the term remission should be used. And they defined remission quite simply. If somebody had diabetes and was taking treatment and now is off all medicines, and the HbA1c is less than 6.5 for at least 3 months, they say you can call it as remission. That is a very simplistic definition. That's what we use now. Now, there are many examples of diabetes remission. For example, what we are going to talk about today is after severe weight loss. So after weight loss, somebody who had diabetes can develop remission. But also, we know that after GDM, once the lady delivers, for some time, even for several years, it can remain normal. Later on, they may develop type 2 diabetes. After bariatric surgery, a lot of remission is possible. But again, in the early stages, the bariatric surgeons tell us that anybody can reverse the diabetes. That's not true. Only in certain situations. We'll come to that later. Stress-induced diabetes. We have huge stress which produces diabetes. Once the stress goes away, diabetes can remit. Drug-induced diabetes, the best example of that is steroids. We all know, and during COVID-19, we know that steroids were used. People used to get diabetes. We stop the steroid, it may go away. There's one last one which is very, not discussed quite often. And this is something which I have been promoting for many years now. Early and aggressive treatment of new onset type 2 diabetes. We have severe glucotoxicity and lipotoxicity. By giving a short course of insulin, you can actually achieve remission. Now, what are the principles of achieving remission? First of all, the calories have to go down because you have to lose weight, some amount of weight at least. So usually in our country, that would translate to low carbohydrate diets. Of course, fat also contains calories. So ultimately, the calories have to come down. Intense physical activity also helps to achieve remission. I mentioned stress, so stress reduction where appropriate, and I already mentioned early and aggressive treatment. Low carbohydrate diet. What do we mean by low carbohydrate diet? In India, most of the diets contain 65 to 70% of carbohydrate. If you cut it down to say 40% or so, it becomes moderate carbohydrate. Less than 25% can be called as low carbohydrate. Less than 10% is very low carbohydrate diet. Now, these very low carbohydrate diets are very difficult to sustain. Very low calorie diets are defined as in the total day, you should take less than 800 calories. Again, in the short term, these things work, but in the long term, sustainability is an issue. Now, how does this remission occur? There's a beautiful slide put forward by Dr. Roy Taylor from UK, where he has shown that whenever you have a positive calorie balance, that gets translated into fat, and that fat is deposited in the liver. We know that in type 2 diabetes, there are two defects. One is insulin resistance, the other is insulin secretory defect. Now, when you have excess fat in the liver, the resistance to insulin increases. Secondly, the fat can get deposited in the pancreas, where the insulin secretion occurs. So your insulin secretion can also go down. When you have both these defects, insulin secretory defect as well as insulin resistance, you get type 2 diabetes. Now, it has been shown that if you start a very low calorie diet, within 7 days, 1 week, the liver fat can come down and the insulin resistance can go away and you can get normal hepatic insulin sensitivity. However, in the pancreas, it can take up to 2 months. And that's what is shown here. If you look at in the liver, the hepatic glucose production goes down, the hepatic triglycerides goes down, and the fasting blood sugar starts falling within the first 1 week itself. In the case of the pancreas, same thing happens, but you can see that it takes about 8 weeks for the insulin secretion to improve. Now, this is a small trivia which you should know, that type 2 diabetes is caused by 1 gram of fat in the pancreas, which is excess. If you get rid of that 1 gram, you can get rid of diabetes also. But to get rid of that 1 gram of fat in the pancreas, in the Europeans at least, you have to lose about 15 kg of weight. In India, it's probably much less, as I'll show you. Now, where does the data come from? This comes from a trial called as a direct trial, or the Diabetes Remission Clinical Trial. Basically what they did, and this again by Roy Taylor and his group, basically what they did was they took about 300 people, 150 people, they gave them a very low calorie diet, about 800 calories per day for 3 to 5 months. And then the other group, they gave them their usual diabetic diet. What they found is quite interesting. Some people lost a lot of weight. For example, they lost up to 15 kg in weight. If you lost 15 kg in weight, almost 86% of that small group, selected group, went into remission. But by the end of 1 year, already 16% of them reverted back to diabetes. So it became 70%. 86% became 70%. But note that even after giving that 800 calorie diet, which is a near starvation diet for the whole day, 800 calories, breakfast, lunch, dinner, all included, there were people who did not lose weight. They lost less than 5 kilo in weight. There was virtually no remission in them. And those who lost 5 to 10 kilos, again, not much remission. Among those who lose a lot of weight, there was a remission, but even that is not sustained for too long. Now, what I was very interested to show you was that this is not a new concept. This remission that we talk about, and the American Diabetes Association has defined it now. This is a paper which we published along with my father in 1987. So it is almost 40 years earlier we have published, and we published a paper actually on remission it was called as NIDDM then, not type 2 diabetes. And we reported on 45 cases of remission. And in our series, you did not have to lose that much weight. Even 2 to 5 kg or 8 kg loss of weight resulted in remission. But we also showed, you can see the weight loss, more than 5 kilos, some less than 2, and 2 to 5 kg and so on. But even there, what we found was that some of them developed re-reversal of their diabetes. That means when they put on weight again, they regained their weight and they became diabetic again. I'm not going to go into details of that because of lack of time. Now, do all patients with type 2 diabetes achieve reversal or remission? No. I've simply made this into an ABCD mantra. A is A1C. The A1C is not very high. Say if it's only 8, 8.5, it's easier to achieve remission. Body weight. Since weight loss is necessary, in thin, underweight people, you may not be able to achieve remission. They have probably the severe insulin deficient variety where you may not be able to. But if you're overweight or obese, you can lose weight and you can achieve remission. Your insulin secretion must be good. If you're already lost all your insulin, how are you going to achieve remission? Duration of diabetes should be short. In the direct trial, it is about 6 years. So if you take somebody who's got 15, 20, 30 years duration, it will be very difficult to get remission. Finally, you need a highly motivated individual to be on a near starvation diet for a long period. Again, effectiveness beyond 2 years has not been shown. And as I'll show you, re-reversal of diabetes or relapse of diabetes occurs. What is this re-reversal or relapse of diabetes? If I show you a case study, it will become very interesting. This is a 35-year-old male with 6 years duration, so short duration. He was given a low-calorie, low-carbohydrate diet. He lost a lot of weight. His aim was to bring his weight below 100 kg. And it didn't do it overnight. It took him a lot of time, but ultimately achieved it. He was able to stop all the tablets, insulin, and maintain remission. Let me show you what happened. He started with 123 kilos. And over a period of months to years, couple of years, his weight finally came down to below 100. That was his target. Now with that, what happened was remission was achieved. And you can see the HbA1c from 8.4, 7, 5.6, 5.4. Now after he achieved this 5.6 and 5.4, we took him off all the medicines. And he was still maintaining his health. Along with that, his fasting blood sugar came down. His postprandial, shown in green, came down. So you can see 89 fasting, 110 postprandial, what he had near 300 milligrams. Importantly, the liver fat came down. I told you that the liver fat melts. The SGOT-SGPT is a crude index of that. You can demonstrate it by ultrasound, MRI, CT, etc. But here is a simple SGOT-SGPT test showing you that the liver fats have come down to normal. Now, let's continue with the story. Now, this man, after he stopped all his medicines, he said, oh, I'm cured, I'm cured, I'm cured. We told him, you're not cured, you're in remission. But he refused to believe because he worked hard on it. He said, I am cured, why should I come for follow-up? You know, my diabetes is reversed. After 9 months, he himself came to us. We asked him, why did you come? He said, I'm not feeling well. So when we checked his weight, it had increased from 99 to 112. Remember, it was 123 earlier. Now it is 112. So he's gained only half of the weight that he lost. But look what happened. His HbA1c, which is 5.4, went to 9.6. He never had 9.6 even earlier. This is his worst control. Why? Because he thought he was cured. So he started eating badam halwa, and he started eating basundi, and he started eating gulab jamun and everything, saying, I'm cured, I'm cured, I'm cured. That is what he wanted to do. And that's why he was working so hard. But now you can see his fasting sugar has gone to 240, postprandial to 321. Never in his life he had like that. So this is the worst control he ever had in his life. And you can see his SGOT-SGPT has now gone up to 66 and 152 and so on. So this is an example of re-reversal or relapse of diabetes. If you ask me, is this one case that you've seen? I've seen hundreds and hundreds of such cases. They'll go on some keto diet, they'll go on some paleo diet, they'll go on some other latest fashion diet, fruit diet, smoothie diet, some other guy's diet. All different people have given different names to it. Then they'll say, see, now I'm off all medicine. They'll go on social media, they'll put before, after pictures, everything they'll put. What they don't tell you on social media is what happened to them after 6 months or 1 year. So re-reversal of diabetes occurs. So I'd like to conclude, ladies and gentlemen, by saying that it's time that we started discussing with suitable patients about remission and tell them about ABCD mantra and encourage them to achieve remission. Diet is very important, so you should tell them that you should be on a low-calorie diet and you should be on it for a very, very long time. And they should achieve weight reduction. We must support them, otherwise they'll give up. Many of these reversal wallahs, what they do is, they have huge teams of supporting teams, coaches who will be phoning you and encouraging you and all that, because they're paying a lot of money to do that. So here, if you are able to provide that support, people get encouraged and they're able to do it. But despite this, ladies and gentlemen, remember that re-reversal of diabetes or relapse of diabetes can occur. This is hardly emphasized by commercial organizations who keep on promising magical cures and reversals of diabetes. They almost treat diabetologists and endocrinologists as if they are criminals. And oh, they give you insulin, they give you tablets and all that. They are with pharma and they are paid to give you insulin. All these kind of lies they keep telling. And they have some shotgun therapy, which in 99% of cases doesn't work in the long run, except for some extremely paranoid kind of individuals who are able to carry on. In my experience, but it's still worth it. It's still worth trying to get the remission. Even a few years you're able to get it, it is still very good. So on that note, I'd like to thank Dr. Kanungo and all the organizers for inviting me to give this talk. Unfortunately, it clashes. This meeting clashed with a couple of social and family engagements that we had, and also with another meeting, and hence I'm not able to be there in person with you. I extend my heartiest congratulations to all of you and wish the rest of the proceedings all the very best. Thank you very much.